my name is Madison Wright. I am an FNP student at West Texas A&M University, and today I'm going to be doing a general physical assessment on a 21-year-old male patient. We have already been over his past medical and surgical history. He has no known allergies. I have obtained his vitals and his height and weight, and everything so far has been within defined limits. I have already tested his cranial nerve number 2, the optic nerve, with the Snellen chart, and that was within defined limits as well. So we are going to start by inspecting his head. I'm going to check his hair, look at the thickness, the texture, the color. We're going to inspect the scalp, make sure that there's no lesions, no bumps, anything abnormal there, and that all looks great. We're going to inspect his head for symmetry, make sure his ears are symmetrical, his eyes, everything like that. So we're going to palpate his sinuses now and make sure there's no tenderness noted. So let's palpate his frontal sinuses and his maxillary sinuses. Okay, perfect. That all looks great. So we're going to then test his cranial nerve number 5, which is his trigeminal nerve. So that I'm going to have to tell me if it's if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, perfect. That looks great. Now we're going to test his temporomandibular joint. So I'm going to have you open your mouth. Perfect. I should be able to fit 2 to 3 fingers right here, and that looks perfect. I'm going to have you open your mouth up again and move your jaw side to side. Perfect. I'm just going to be listening for any clicking noises, checking for any discomfort in doing that. That looks great. So we're going to move on to his eyes now. Where's my thing? Okay, so I'm going to check his pupils. Okay, look straight ahead of me. Perfect. Okay, perfect. That looks great. Now I'm going to have you, we're going to check accommodation now. So I'm going to have you look at this. Okay, and then with only your eyes, look behind me. Perfect. And then here again, and then behind again. Okay, perfect. That looks awesome. So now we are going to, I'm going to inspect his conjunctiva and sclera. Sorry. Conjunctiva and sclera. Make sure that those are nice and pink and moist and everything. That all looks great as well. Okay, so I'm going to check cranial nerves number 3, 4, and 6 now, which are the oculomotor, the trochlear, and abducens. So I'm going to have you follow this with your eyes only. Okay, perfect. That all looks great. And then at this point, I would look at his optic disc and make sure there's no abnormalities there. So that all looks great. So we're going to move on to the ears now. I've already looked to make sure that they are symmetrical. So we're going to palpate, make sure everything feels normal, make sure there's no growth, nothing like that. I'm going to look inside now, just checking his tympanic membrane. Okay. Perfect. That all looks great. Now we're going to be testing cranial nerve number 8 with the whisper test. So I'm going to stand kind of slightly behind you here, and if you'll just tell me, repeat whatever you hear me say. 4K2.
4K2.
Okay.
4K2.
Perfect. Okay, so now we're going to do the Weber and the Rhine test. So we're going to do the Weber test first. I've got my tuning fork here, and can you feel that evenly on both sides?
Yes.
Okay, perfect. So that was the Weber test. Now we're going to move on to the Rhine test to check air to bone conduction. It should be 2 to 1. And I'm just going to have him tell me whenever you stop hearing this, okay?
now.
Okay, perfect. We're gonna do the other side now.
Now.
Okay, perfect. Okay, so we are going to move on to the nose now. I'm going to just generally inspect the nose, make sure that there's no abnormalities there, everything looks normal. I'm going to note, let's see. Okay, so we're going to take a look inside now and make sure that we don't see any polyps, any septal deviations, anything abnormal like that. Okay, perfect. That looks great. We're going to check patency now. So I'm going to have you breathe in and out. Okay, perfect. And then again. Okay, any difference in that? Were you able to breathe okay in both sides? Okay, perfect. So we are going to check for cranial nerve number 1 now, which is the olfactory nerve. So I'm going to have you tell me what you smell.
Alcohol.
Perfect. Okay, so nose looks great. Now we're going to move on to the mouth. So we're going to look at his lips and check for color, make sure they are moist or if they're dry, just kind of a general inspection of what we see. I'm going to have him open his mouth now. So if you can open your mouth, perfect. And move your tongue that way and then that way. Perfect. We're just going to look, make sure we don't see any lesions, anything concerning any growths, check for loose teeth, all of that fun stuff. So I'm going to have you stick your tongue out and move it side to side. Perfect. You can stop. So that was checking for cranial nerve number 12, the hypoglossal nerve. Now we are going to check cranial nerve number 9, which is the glossopharyngeal nerve, and that's just checking for a gag reflex. Okay, perfect. That was great. Now we're going to check cranial nerve number 10, which is the vagus nerve. Okay, now I'm going to have you stick your tongue out and say ah.
Ah.
Okay, perfect. So I was checking his uvula, making sure that had the correct reaction. And then I also, while we did that, I looked at his throat to check for any abnormalities and check his tonsils, check for placement there and everything. Now we're going to finish up with the cranial nerves while we're still focused on the head and face area. We're going to check cranial nerve number 7, which is the facial nerve. So I'm going to have you smile. Perfect. And then puff your cheeks out. Perfect. Okay, and then lastly, cranial nerve number 11, which is the spinal accessory nerve. So I'm going to have you shrug your shoulders against gravity. Perfect. One more time. Perfect. Okay, so we're done with the head and neck now. We're going to move on to, or we're done with the head. We're going to move on to the neck. So I'm going to check, make sure everything looks normal. It does. Check for tracheal deviation, which I do not feel any or see any. Okay, so I'm going to have you kind of scoot forward and turn that way just slightly. Okay, so from behind, I'm going to palpate his thyroid, and I'm going to have you swallow. Okay, perfect. So that was just checking to make sure there are no nodules, make sure his thyroid is not enlarged or anything concerning like that. I'm going to move on to the lymph nodes now. We're going to check the cervical, supraclavicular, occipital, and preauricular lymph nodes. Make sure that there's no swelling present, tenderness, anything like that. So you can kind of scoot back to where you were. Okay, perfect. Just feeling for all of his lymph nodes here. Okay. Okay, perfect. All the lymph nodes feel good. I don't feel any swelling. No tenderness, right? And none of that hurt or anything. Okay, perfect. We're going to, I'm going to have you tilt your head side to side for me. Perfect. No tenderness or anything there. Okay, perfect. And then against force here. So tilt your head this way. Perfect. And then the other way. Okay, perfect. So that all looks great. We're going to move on to his carotid pulses, we're going to feel those one at a time. Okay. Perfect. Those are both 2+. And now, while we're at the carotid, we're going to listen to both of those. Okay, perfect. I don't hear a bruit in either one of those, so that's great. We're going to move on to his chest. So we're gonna start with the posterior. So I'm gonna have you scoot forward again, and then turn that way. Okay, perfect. So we're gonna start with a general inspection of the back. Actually, I'm gonna have you remove your shirt for me.
Okay.
Thank you. Okay, so we're gonna start with a general inspection of the back. I don't notice any masses or anything like that. Just kind of feel around, make sure that everything feels normal, which it does. We're going to check for any costovertebral tenderness, which I don't feel. Okay, perfect. We're going to percuss. Okay, perfect. And I'm going to listen to his breath sounds here. Okay, just breathe normally for me. Okay, now I'm gonna have you say the words 99.
99, 99, 99, 99, 99, 99.
Okay, perfect. So we're done with the back. I'm gonna have you sit back for me just a little bit. Okay, perfect. So now we're gonna move on to the chest. First, we're gonna start with just kind of a general inspection. Make sure that I'm not noticing any masses or lesions or anything concerning here. We're going to, so the inspection of the chest is done. We're going to go ahead and percuss. Okay, that was just checking for any consolidation, anything concerning there. And now we're going to take a listen. Okay, perfect. So the our lung assessment is done. Everything looks great. We're going to move on to the heart. So we're going to listen for the aortic valve, which is going to be found in the right sternal border, second intercostal space. Then the pulmonic valve, which will be found in the left sternal border, second intercostal space. We'll move on to Erb's point, which is in the left sternal border, third intercostal space. The tricuspid is the left sternal border, fourth or fifth intercostal space. And then the mitral valve, which is the apex of the heart, is down here in the on the left midclavicular line in the fifth intercostal space. So we're going to go ahead and take a listen here. I'm going to turn it around to the bell here. We're going to make sure we don't hear any murmurs. Okay, perfect. So I heard a strong S1 and S2. I did not hear any S3, S4, no abnormal heart tones there, so that all looks great. We're going to check for jugular venous pressure now. So I'm gonna have you lay on your back here, just right there. So we want him at about a 30-degree angle. This is about as close as we can get to a 30-degree angle currently. So we are going to, I'm gonna have you turn your head away, and we're going to measure. We're gonna measure at the meniscus, and it should be about 3 to 4 centimeters normally. Okay, so while he's laying down, we're gonna move on to the abdomen. We're gonna start with a general inspection of the abdomen, make sure that I'm not seeing any masses, any lesions, anything concerning. That all looks great. We're going to listen next. Perfect. Bowel sounds are all active. I'm going to now, since I have my stethoscope already on me, we're going to go ahead and listen to the aorta and the femoral arteries. Okay, perfect. So now we're going to move on to percussion. We're going to check for the liver span and check for the spleen here. Okay, awesome. And now we're going to move on to light palpation. So we're going to be feeling for any masses, any nodules, anything like that. And we're also going to be making sure that he doesn't feel any tenderness while this is happening. Okay, we're just checking for the liver span here. That looks great. Checking to make sure we're not able to palpate the spleen, which I'm not. I'm not feeling anything concerning there. And we're going to move on to deep palpation. Checking for these same things. Making sure that we're able to feel a liver span here. Making sure we don't feel a spleen over here. Checking for any masses, any nodules, anything like that. And that feels great. So while I have him laying down, we're going to go ahead and do some range of motion exercises. So I'm going to have you raise one leg at a time. Perfect. And the other one? Okay, perfect. Okay, so I'm going to have you point your toes and then flex them. Okay, perfect. And then we're going to check for range of motion here. So we're going to do some abduction and adduction. Abduction and adduction. Go like this. And internal and external rotation. Perfect. And then up the knee. And then same over here. Internal and external rotation. Okay. Perfect. So that all looks good. None of that hurt, did it? No pain or anything like that? Okay, perfect. So we are going to, I'm going to have you sit up now. Perfect. You can put your shirt back on if you want to. Okay, so we're going to continue on with the range of motion exercises. I'm going to have you do the same thing with your shoulders. So I'm going to have you raise your arms up like this. Perfect. And then down. Okay, just checking that abduction and adduction. I'm going to have you put your hands up like this behind your head. Perfect. And then down behind your back. Perfect. Okay, so now we're going to, I'm going to check your elbows. Make sure that they are, make sure your range of motion is right there. I'm going to have you bend right here. Okay, perfect. Now I'm going to have you hold your hands out here. Perfect, and then just flip them like this. Awesome. So while we're doing this, I'm just checking his fingers, checking for any clubbing, anything like that. I'm going to check for cap refill as well, which is great. So I'm going to have you flip your hands back and forth really quickly. Perfect. Okay, so that was moving on to our neurosensory checks. Real quick, I'm gonna check grip strength. So I'm gonna have you squeeze my hands. Perfect. Okay, so now we're gonna move back on to neurosensory checks. I'm gonna have you hold your hands out like this, and I'm gonna have you close your eyes. I'm gonna draw a number, and if you could just tell me what number that is.
An 8.
Perfect. And over here.
8.
Perfect. Okay, keep your eyes closed. And I'm going to place an object in your hand. If you'll wrap your hand around it and tell me what that object is.
It's a key.
Perfect. Okay. So you can open your eyes now and put your hands down. So I'm going to inspect his lower extremities now. And just make sure that everything looks good. I'm going to check for hair growth down here on his lower extremities. He does have hair growth. I'm not seeing any lesions. I'm not seeing any signs of venous or arterial insufficiency, so that's great. I'm going to touch one of your toes. If you could close your eyes. Perfect, you're on this. I'm going to push on one of your toes, and if you could tell me which toe it is.
That's my big toe.
Perfect. Okay. So, and then I am going to have you hold your hands out again. Keep your eyes closed. Okay, I'm going to touch one of your fingers, and if you could touch your nose with that finger. Perfect. Okay, you can open your eyes now. And now I'm just going to have you take your heel and run it up and down your shin on both sides. Perfect. And then over there. Perfect. Okay, that looks great. So we're going to now check the rest of his pulses. So we checked his temporal pulses earlier, and we also checked his carotid pulses. So we're just going to check all of his pulses from here down. So I'm going to check brachial pulses. Okay, and have you hold your hands out like this. We're going to check radial. Perfect. And all of his lower extremity pulses here. His pedal pulses. Okay, perfect. Those pulses are all 2+, so that looks great. We are going to check his reflexes now. So I'm gonna have you hold your arm out like this. Okay. Okay, perfect. And we're gonna check that was his triceps, checking the reflex on his triceps. We're gonna check the radial now. So I'm gonna have you hold your hands out like this. Perfect. Okay, perfect. And now we're going to move on to his knees and his Achilles. So we're checking his reflexes in his knees. Okay, perfect. And Achilles. Okay, so that all looks great. I am now going to have you stand up. Okay, and I'm going to have you close your eyes. Okay, perfect. You can open them. So that was the Romberg test. That's to make sure, oh, his head's getting cut off, I'm sorry. That was to make sure that he doesn't experience any dizziness or loss of balance whenever he's standing up and has his eyes closed, which he didn't, so that's good. So now I'm gonna have you walk heel to toe, just like this, walking that way. Perfect, okay, and you can turn around and come back. Perfect, just checking his gait, making sure everything looks great there. And now I'm gonna have you bend down like you're touching your toes, just as far as you can go, perfect. Okay, so while he's bent down, we're gonna be inspecting the spine and making sure that there's no curvature of the spine, any masses that have suddenly, popped up, anything like that. That all looks normal, so we're great, you can stand back up. Okay, so that ends our general physical assessment. You can go away if you'd like. Okay. And now we're going to just kind of discuss for a female or male patient the breast examination. So you'd have them lie flat on their back and do circular motions around the breast and check for any nodules. And if you do find any nodules, we're going to note whether they are able to be moved or not, whether they are smooth, whether they are spiny, if they're sharp, anything like that. We're gonna make note of that. The genital inspection for a female you're going to basically just inspect, make sure that you don't see any masses, any lesions there, any noticeable discharge, anything like that. That inspection also will come with some questioning for the female, making sure that she has not experienced any abnormal discharge, any itching, burning sensations, anything like that, including kind of some social history, making sure that she's using protection and all of those good things. So for a male patient, it's fairly similar as far as inspection goes. We're going to make sure that we're not seeing any lesions, any warts, any discharge from the tip of the penis. We are also going to check the testicles, make sure that there are 2 testicles and that they are both inside of the sac, and make sure just that everything looks normal there. We are also going to be doing a prostate exam, which involves having the man bend over. You're going to insert 1 finger gently, a gloved finger with lube on it. You're going to feel for the prostate and make note if it is enlarged, if it is smooth, etc. And then a rectal exam kind of goes along with that. You're gonna just look at the patient's rectum and make sure that you don't see anything abnormal there. Note if you see anything hemorrhaging from the anus or anything abnormal. Yeah, and that concludes our general physical assessment. Thank you.